Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Ricky Johnston of the Gastroenterology Associates of Columbus, and today we're talking all about ulcers. Welcome to the show, my friend. How are you?
Great, thank you for having me.
Nice to see you.
You too.
All right, ulcers, I know a little bit about. You know, I had some last year,
I heard, I
and
remember.
it caused major issues. Talk to me and the audience at home. What are actual ulcers?
Ulcers are primarily, we think of occurring in the small intestine and the stomach, but they're basically where the lining gets broken down and starts to erode, and it creates just an ulceration in the lining of the intestinal tract.
Well, how do they occur?
Two main reasons that they occur. Number one is H. pylori, which is a bacteria that I think we've talked about in the past, but H. pylori is a bacteria that primarily lives in the stomach lining. And whereas stomach acid would generally kill most bacteria, this bacteria thrives in the acid environment. And for whatever reason, it breaks down kind of the protective mechanisms of the gastric lining, or the stomach lining, and can promote ulcer formation. Number two cause is pain medicines like aspirin, Aleve, ibuprofen, Motrin, over-the-counter pain medicines, basically except Tylenol.
Well, exactly, because then I will share this. We've talked about it off camera.
Yeah.
I got a strep throat. They gave me penicillin, antibiotics, and steroids. 2 weeks later, complete eruption. I had 4 ulcers, 3 or 4 ulcers, had to have blood transfusions. I had no idea what was wrong with me. So let's discuss some of the symptoms of what someone would see or feel when you have an ulcer.
Most common thing we see is belly pain, just pain in the middle of the upper abdomen. Some people can have nausea and vomiting. Bleeding is one of the things that sounds like that happened with you. You can vomit blood. You can pass blood from behind, and generally that comes out looking black or tar-like. Those are the main ones we think about.
All right.
You know, importantly, I think some people don't have ulcer or don't have symptoms. We can have some people who present just they're incidentally found to be anemic and have low blood counts, and during their evaluation they can be discovered to have ulcers.
Well, and that's the funny thing, because I was just telling people I had a sore stomach from the medications that were given to me. I didn't check the signs.
Yes.
That was the problem.
Right.
And I should, considering I do mostly medical interviews, right?
Yes, we failed you. We should have had you better educated.
Exactly. All right, let's talk a little bit about the treatments if we can.
Sure.
What is possible?
Well, usually we treat just with antacids, and there's different kinds of antacids or medicines that lower the acid levels in the stomach, but primarily we use the class called proton pump inhibitors, and that's things like Prilosec, Nexium, Protonix, Prevacid. Those medicines actually shut the acid pumps off in the stomach, which brings the acid levels down, and then we just let the body's natural healing mechanisms take over. And with the lower acid levels in the stomach, then those ulcers can start to heal on their own.
Now that would be a prescription medication, correct?
Well, you can get them over the counter, but generally we would prescribe a higher dose, prescription strength.
Which is what I was on.
Yeah.
Let's talk a little bit about how long before you would stop feeling those symptoms.
It varies. You know, some people feel better pretty quickly, but it usually would take a couple of months for an ulcer to heal up. And so when somebody's found to have ulcers, we like them to stay on those medications for at least 2 months, even if they start to feel better, because we want to really make sure that they get healed up.
All right, do you hear people say, oh my gosh, I'm so stressed, you're going to give yourself an ulcer?
I'm glad you brought that up.
Yes.
That
is possible?
It really is not. There's this thing called stress ulcers that we can see sometimes in hospitalized patients who are in the ICU, but that's more stress related to whatever medical illness that they have going on. But stress in and of itself, if you're anxious or somebody's got you in a tizzy, that generally is not going to cause an ulcer in the stomach. What it does is makes people's stomach hurt. They can have some cramping or whatever, just because the stress can cause belly pain sometimes, but it doesn't actually cause an ulcer.
Okay, we just want to reiterate the signs. Bit of pain in the stomach.
Yes.
Bleeding, either vomiting or passing blood.
Correct.
And that's something more for women and men, or it's basically across the board?
We see it across the board with both.
Yeah. We always get great information from you. Thank you. If you want to find out more, there it all is up on the screen for you. Dr. Ricky Johnston of Gastroenterology Associates of Columbus. We'll be back after this short break.